And Eric and Christina, meanwhile, the first person in the U.S. to be diagnosed with the coronavirus, expressing gratitude for his successful treatment at a Washington State hospital. He told the Seattle Times, quote, "I would like to thank the doctors, nurses, and entire team at Providence who cared for me. I appreciate all of the concern expressed by members of the public, and I look forward to returning to my normal life." Joining us now is Dr. George Diaz. He's a section chief for infectious diseases at Providence Regional Medical Center, Everett. And Dr. Diaz, thank you for joining us.
Good morning.
Good morning. If you could start first by telling us how this patient was treated and why is it considered successful?
Yeah, well, we placed him in isolation that was strictly, appropriate for this sort of infection, where we could prevent any infection of other providers, nurses, any other caregivers. The patient himself, early in his presentation, had relatively mild disease. About a week into his course, he got worse. Developed pneumonia, and at that point, given the reports we had gotten out of China in a paper from the Lancet, and under the consultation of the CDC, we elected to give him experimental remdesivir, a novel antiviral medication. And within 24 hours, he improved significantly. This was quite encouraging, and he improved and thereafter remained without fevers and felt much better. Over the next few days, he improved to the point where we felt it was safe for him to be discharged to home under the care of the local health district. He was very happy to be able to go home, and we were relieved that he improved and was able to return home as well.
And I understand that he lives alone and remains isolated apart from that caretaker. Is there any potential for a relapse, or is his immune system, compromised, making him more susceptible to catching viruses like the flu?
So he does live alone, which is very helpful, and we do have a support system for him while he remains in isolation at home. At this point, we feel he's basically fully recovered and should not really be at risk for any further infectious complications or a relapse for that matter.
Mm-hmm. And you said that you used, I believe you said it was an experimental antiviral medication that you gave this patient. Can you apply this same treatment for all people infected with the coronavirus, or does it depend on the stage of their infection?
Yeah, so at this point, the CDC has been working with the authorities in China and have recently opened a large clinical trial of Chinese patients looking at those with severe disease as well with mild to moderate disease. And so we're very much looking forward to the outcome of those randomized controlled trials that will help inform us as to the effectiveness of this antiviral for all patients. We had a positive response in our one patient. We would certainly like to see that data come out.
And how soon would you get that type of data?
I think they're looking to get information over the next couple of months to enroll patients within that study.
You are monitoring in the meantime more than a dozen people who had close contact with the patient that we started out talking with, the man there in Washington. Have they shown any corona symptoms? And should families, Dr. Diaz, or medical staff get the same treatment or injection, that you gave this patient? And, is it kind of like getting the flu shot for prevention, if you follow me?
Yeah, so as far as we know, all the contacts of this patient haven't yet been positive. We're not aware of any positive patients for coronavirus other than our single patient. We are doing monitoring of caregivers who had contact with the patient to make sure that they don't develop any symptoms, but we're confident with our isolation practices in that there were no exposure amongst caregivers within our hospital.
Okay,
and
Dr.
in terms
Diaz,
of this medication.
Keep up the great work. Good luck, sir, and thank you very much for your time.
One of the New York City Police Department